ECG of the constrictive pericarditis is of low voltage. How about the ECG of acute pericarditis? ECG of acute pericarditis has ST elevations. Also, cardiac enzymes are increased in acute pericarditis. The other cardiac condition in which cardiac enzymes are increased is myocarditis. So the troponin I levels may be elevated in up to 50% of patients with pericarditis, but without a rise in. So how do you differentiate the ECG of the acute pericarditis with that of acute myocardial infarction? ST elevation in the ECG of acute pericarditis is concave upward, whereas that of the acute myocardial infarction is convex upward. In acute pericarditis, the ST elevation with concavity up, and in myocardial infarction, ST elevation with convexity up. In acute pericarditis, lead AVR may show ST depression. When does the EKG returns to normal in both pericarditis and myocardial infarction? In acute pericarditis, EKG returns to normal after weeks to months in fourth stage, whereas ST elevation in myocardial infarction returns to normal quickly. And also there are no reciprocal changes in acute pericarditis, whereas we have reciprocal changes in the ECGs of acute myocardial infarction. Also there are no Q waves later on, but there are Q wave in acute myocardial infarction later. And also the arrhythmia and conduction defects are rare with acute pericarditis. So what is the importance of echocardiography in acute pericarditis? Regional wall motion abnormalities help to differentiate acute pericarditis from that of the coronary artery disease and myocardial ischemia. How do you differentiate frictional rub which appear in acute pericarditis with the pleural rub which occur in pulmonary conditions or pleurisy? Frictional rub is heard throughout the respiration, whereas pleural rub stops when breathing is stopped. Patient gets a little bit relief on sitting in acute pericarditis where there is no change with the positional change in the pain of the acute myocardial infarction. So what other condition pain is relieved or decreased on sitting? It is the acute pancreatitis pain of which is decreased on sitting position. What is the treatment of acute pericarditis? Is colchicine, steroids in resistant cases, and aspirin. Why anticoagulants are not used in acute pericarditis? Because it may cause intrapericardial bleeding and cardiac tamponade. Pericardectomy is not indicated in the management of acute pericarditis. When does acute pericarditis occur after myocardial infarction? Acute pericarditis occurs about 1 to 2 weeks or day 7 to day 10 after acute myocardial infarction, but it may also occur later and is known as Dressler syndrome. And what is the cause of this acute pericarditis? It is due to an autoimmune response to myocardial injury. And the treatment for that is colchicine and aspirin. Why non-aspirin, non-steroidal anti-inflammatory drugs should be avoided in acute pericarditis after myocardial infarction? Non-aspirin, NSAID, especially indomethacin, inhibits new collagen formation, thus impairing the healing process of the infarcted tissue and may cause rupture. Heparin is also avoided in the Dressler syndrome because it may lead to hemorrhage and pericardial tamponade.